Good afternoon. Good morning to all of you. My name is Paola Hernandez, and I work as Food Projects and Policy Officer at Healthcare Without Harm Europe. I will be the moderator of this webinar, in which we'll be discussing how to transform hospital food towards a more sustainable food. But before getting to the heart of the matter, I will say a few words on Healthcare Without Harm Europe, and then I will introduce our speakers. Healthcare Without Harm Europe is a non-profit European coalition of hospitals, healthcare systems, healthcare professionals, local authorities, research, academic institutions, and environmental and health organizations. Our vision is to help the healthcare sector mobilize its ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. We seek to transform healthcare worldwide so it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. To this end, we work under three overarching goals: protect public health from climate change, transform the supply chain, build leadership for environmental health. These are our main policy areas in which you can see here sustainable and healthy food among them. Healthcare Without Harm Europe has currently 88 members in 25 countries of the WHO European region, including 16 member states of the European Union. We all know that talking about sustainability in healthcare can be challenging. However, step by step, we can see how hospitals are addressing these problems and bring practical solutions into action by procuring high-quality, fresh, seasonal, and organic food, moving towards plant-based proteins, or preventing and reducing food waste, among other strategies. Healthcare Without Harm Europe has been working for years on diverse core themes such as public procurement, food waste management, food as part of patients' recovery, menu design, vending machines, protected meal times, and staff training, and yet there is still a long way to go. It is therefore important to recognize how the beauty of human connection enables to know other good examples around food-related issues. First, we will hear from Dr. Susanna McWilliam, who is Program Manager of the program Food for Life Hospital Leaders Soil Association, who supports NHS trusts to transform their approaches to food for the benefit of patients, staff, and visitors, and to ensuring a health-promoting approach to food in hospitals. Welcome, Susanna, and we are looking forward to your presentation.
Hello, hi everyone, and thank you very much, Paola, for the introduction, and to Healthcare Without Harm for inviting me along to speak, and to everyone who's listening today. If anyone has any problems hearing, do please put something in the text box and I can slow down or speak more clearly. So as Paola has mentioned, I'm the Programme Manager of Soil Association Food for Life hospital programmes. At Food for Life, we worked with over 70 hospitals around the UK, supporting them to improve their food culture. And today I'm going to be talking about some current work that we're doing, co-designing a vision for a good food hospital. So that vision has sustainability and health woven throughout, and outcomes to benefit patients, staff and visitors, and of course the environment. So at Food for Life, a little bit more about us. Well, the Soil Association is a UK-based food and farming charity. We've been around for over 70 years, and connecting human and environmental health is really at the core of what we do. So Food for Life is one of the programmes that Soil Association runs, and it's an award-winning UK-wide programme whose mission it is to make good food the easy choice for everyone, whoever and wherever they are. So we have a series of programmes across different sectors, as well as hospitals. We work across the school sector, in care homes and in workplaces. So what does good food mean for us as an organisation? Well, at Food for Life, it means healthy and sustainable food, high animal welfare standards, but also there's something around that human connection at food that it brings us all together, providing opportunities to socialise with others. And today, of course, because I'm speaking about the UK, I'll be using a little bit of jargon. So, for example, when I talk about the NHS, it means the National Health Service. So in the UK, that's our overarching structure. In a way, it's our publicly funded health services in the UK. And although we have an overarching UK-wide health service, there are different regulations under different governments, so slightly different systems and ways of funding in place in England, Scotland, Northern Ireland and Wales. So I'll be speaking a little bit today about UK-wide ways of working, but also a little bit about how things work in England as well. I'll also be talking about NHS trusts. So those are large organisations, basically groups of hospitals, and sometimes they can be an acute hospital, sometimes mental health, and sometimes community. So some trusts might just have one hospital, but some trusts could have as many as 8 hospitals within them. So they do really vary in size across the UK. Okay, so just moving on, today what I'd really like to look at is a bit of our background to the Good Food Hospitals project, talk a bit about our co-design approach, which is the methodology that we've used, and share some of the insights that have been coming through that co-design process. But to set the scene, this is a policy background in England. I just wanted to read this quote out from you from a policy document from 2014 that sets the scene. So it says that hospital food can and should be a vehicle for improvement and a role model for food in the local community. It should complement the patient's care and enhance their stay. It should help staff and visitors choose a healthier lifestyle, and it should support our economy and protect our environment. So here the aspiration at policy level is really clear, but of course in practice there are quite a number of challenges that may be felt in countries beyond the UK. Some of those challenges, for example, are those tightening budgets that are felt really keenly at the moment within the UK, and budgets that have led to cuts and slashes in food budgets. For us in particular, inflexible and lengthy contracts can be a real challenge to sustainability. So quite a number of our trusts in the UK actually contract out their food services, and quite often sustainability in a way can be costed out of the food services that are provided. And if a trust wants to make some positive changes to its sustainability, it can be quite complex when there are lengthy contracts in place. Also the fact that food works across multiple disciplines, and where you're bringing together perhaps caterers, nursing staff, sustainability leads and dietitians, sustainability is not always highest on everyone's different agenda. So for us as part of Soil Association and Food for Life's commitment to driving positive change in the sector, we've been developing a way to demonstrate and drive continuous improvement from a whole hospital perspective. So the aim of this work really is around inspiring people to reimagine hospital food, shaping that vision and a toolkit for truly health-promoting hospital environment, also one that supports its local community through food. So we have 3 key outcomes. One, that hospitals are recognised as settings that can promote and value good food. The second really is around buy-in from senior staff, but also from staff on the ground. And the third is it's very much about continuous improvement in hospital food, ways to inspire and share good practice in the sector. So in the development, we've used a co-design approach, as I mentioned earlier, and co-design is, in essence, it's designing services based on input and views of service users and others in the sector. So those would be gathering the views of patients and staff and visitors, but also policymakers and other sector leads. So as this slide shows, there are a series of different stages, and the first stage on the left-hand side is the discover stage. That's really about gathering insight. So to do that, we've been using these different methodological approaches: ethnography, interviews, design labs, and best practice. So as part of our ethnography, a bit of our research, I wanted to share Lucy's story with you briefly. We spent a whole day with Lucy. Lucy was an 86-year-old who lives alone and enjoys spending time with her daughters and watching a lot of TV. Last year, Lucy spent 13 days in hospital as a result of a transient ischemic attack. And this story really is seen through the eyes of Lucy, but also her daughter Rose, who's her primary carer. Without going into all the detail of the case study, in short, Lucy had a really poor experience when she was in hospital for those 13 days. She was a picky eater, which isn't unusual. She was very frail, but also she went under the radar because she wasn't one to make a fuss about food. So during her 13 days, really she was given incorrect food at times, unsuitable textures for her particular condition. She was given little support to eat. They failed to monitor her properly, and really no guidance was given on food at discharge. So when she was brought back home, her daughter was really nervous about what types of food were appropriate for Lucy. So in the end, actually, her daughter discharged her early and said, I'm not going to sit back and watch my mum deteriorate. We need to get her home. They dealt with the stroke part, given her medications, but her diet and hospital had not given her the strength. She was so malnourished. So I think this demonstrates really nicely the kind of value of spending time to understand people's real stories, gives us depth to kind of gather some of the challenges in the sector. What we've also been doing is doing some design labs in NHS trusts. So there we've been going out and we've been talking to patients, staff and visitors. We've been gathering their views and experience of hospital food and piecing those together. One of our other approaches has been to identify good practice, and that's come from both the UK and beyond. So this slide we've got some examples of a trust in England, North Bristol NHS Trust. They're really a trust with a great example of a whole settings approach to good food. So they're doing things for patients, for example, where they've got fantastic menus that talk about their locally sourced food. For staff, all of the meals in the staff restaurant have nutritional labels on. There's a rooftop herb garden for staff to be able to go out and eat in, and they've developed their own in-house coffee brand, so some of the profits can be put back into the hospital itself. In pulling all these different methods together and our different findings together, including some of the interviews that we conducted, we did a thematic analysis of all of the themes that came through. So this slide is really an example of one of the themes that came through, that said people asked or suggested there should be more information about what is in hospital food and where it comes from. And people felt, for example, that information would really help people to make better dietary choices. It might help raise the profile of locally sourced food, and it might help educate people about the importance of eating well when they were in hospital, but also to inspire people to eat better when they were at home. And there's a quote at the bottom that helps to kind of support this theme. The next phase, once we'd gathered all of our insight, was the define phase, the sort of second in from the left-hand side. So in this define phase, we developed a blueprint using all of the information that we've gathered together, and 5 key themes emerged that I'm going to run through in the next slides. So this is how our themes look on this first slide. The first theme is around wanting food to be recognised as an important part of my care. In other words, food having an absolutely vital role in hospitals. So in the white boxes along the top are our different stakeholder views and themes. Just underneath that, we have some quotes to illustrate these views. And then in the circles underneath that, what we call our what ifs. Those are our ideas, our inspiration really about the types of things that you might want to put in place within your trust. And then along the bottom, on the banner on the bottom, are just some little coloured dots. Those show where this information has come from and how we've analysed it. So I'm going to go through the 5 key themes now in the following slides, but I'll just pick one example out of each slide to talk through in more detail. So on the next slide, which is recognising food as an important part of care, one key theme that came through was around the social value of meal times being absolutely vital. So that's really looking beyond nutrition, if you like. So asking that a hospital provides a positive dining experience. And the stakeholder felt that it's not just about the food, is it? It's the presentation, the environment, the timing. You wouldn't want to eat in your room with a bedpan in there. So I think that kind of brings to life how important it is to feel like you've got a comfortable and welcoming environment when you're sitting having your food. And one of the what-ifs and the ideas would be, well, imagine if you were in hospital and there were private spaces on the wards where you might be able to go and eat a meal, perhaps with your partner, with your daughter, with a friend, and create the kind of social, more homely experience. So these ideas and these what-ifs, they're not all rocket science, they're not necessarily new things, and actually quite often they are done in a number of different hospitals. But in a way it's that idea and that inspiration, that sort of shining a spotlight on best practice that hopefully comes through in our what-ifs. So moving on to our next slide. What came through from our research is people wanting the hospital environment to support good food choices. So the example that comes through here, one of the examples, is a theme of wanting to have access to healthy and nutritious and affordable options at any time. So access, one of the what-ifs would be that access to facilities for staff and visitors to prepare their own food. And in practice, such facilities are really varied across the NHS estate in the UK. So on some wards, staff may not have any access at all to small kitchens, and particularly if they work in the evening times, that can be a challenge. Moving on to our next key theme that emerged. Paola, I'm just having a little bit of difficulty moving the slide on, so I don't know if, oh, there we go. Our next slide, our next key theme was around people wanting the hospital to minimise their impact on the environment. This was a really strong theme that came through from staff, visitors and patients. And one of the themes that emerged was wanting food that is seasonally and locally sourced. And this quote, this person said, well, we live in a wonderful region and there's plenty of fresh, local and seasonal food around. And one of our what-if ideas here was, what if food could be locally sourced to support the local farmers and the local economy? And it's probably worth noticing here that I'm not sure if it's the same in the rest of Europe, but minimising the use of single-use plastics was a very strong emerging theme in this area as well, and is particularly dominating headlines at the moment in the UK. And the National Health Service is trying to do something about this. Our next key theme is around wanting hospitals to support the health and well-being of its staff. Again, very strong in the UK at the moment through a number of policy initiatives. It was felt that staff should be supported to eat well and to have breaks and to have areas to socialise. So breaks was one area where many of the hospitals that we spoke to, staff actually just don't have time to stop and have anything to eat. So one of our ideas to inspire was, well, what if there were fresh food trolleys that actually went out to staff in the night time and in the daytime, actually bringing good food directly to the wards. We are aware of a number of different hospitals in the UK where this is already happening. So part of this work, again, is around inspiring change and sharing those case studies and trialling things in different hospitals. Then we have our last key theme, which is I want my hospital to care for my community. The hospitals that were involved in this piece of research didn't feel as if they sat in isolation. They felt as if they had a vital role to play in the health and well-being of their own community. So, for example, they wanted the hospital to provide opportunities for social contact through food. And we have some lovely what-ifs about school children coming into hospitals, perhaps in the school holidays, to alleviate holiday hunger. We have some examples of trusts that run lunch clubs for pensioners, for people who are retired in the hospitals as well. So a way to kind of really generate hospitals as a hub of a local community. After we defined our key themes and after the first kind of iteration, we had a workshop where we pulled together 17 different NHS trusts and different key stakeholders to really start to test out that framework. And actually what I've just shared with you, those 5 key themes, those were further developed once we'd run this workshop in Birmingham. At the same time as running the workshop, we tested out some ideas. Well, how do you take this forward was our question. How do you take this forward and what is going to work best for the sector? So we prototyped a number of ideas, for example, a campaign, building a good food hospital from scratch, perhaps an awards ceremony, but by far the most popular idea and the one we will be testing is that certification for a whole hospital award. The participants are really keen for a way to drive and recognise continuous improvement and for something to benchmark themselves against and actually to help demonstrate and celebrate positive change in actions. So the next stage in our development then is the testing or testing this blueprint, and we're just in the process of working with 2 early adopters to test elements of our framework. So I just wanted to finish off on this slide that comes back to our aims and outcomes, and really through this work what we're wanting to do is sort of share this vision and toolkit that drives continuous improvement and healthy and sustainable hospital food throughout the UK. And so thanks very much for listening, and any comments or questions now I very gratefully received, and my details are on here as well if anyone would like to get in touch afterwards. So thank you.
Thank you very much, Susanna. It's been really interesting. All the design process that you have. Before passing the word to Hayley, maybe I would like to ask you one question about this process, mostly about the first phase, which is discover. I don't know if you have found here some challenges in terms of approaching patients, staff, or visitors.
Thanks very much for your question, Paula. And that was around, did we have any particular challenges in getting our participants for ethnographic research? I think with this particular group, it is always it is particularly challenging, and so we did invest quite a bit of time into this phase. And I think the fact that Lucy was accompanied by her daughter Rose was incredibly helpful, because particularly for older vulnerable patients, sometimes having an advocate or someone by their side can make the process a little less daunting and help to support that older person to be able to share their experiences. When it comes to staff, again, it was working with staff, making sure that we worked around their lunch times, perhaps went somewhere where they weren't going to be disturbed by other people, and actually just giving the freedom and the space for those people to kind of really share their experiences. And ethnography, in many senses, is about taking people exactly as they come and ensuring that they have the space and the freedom to kind of share freely without us guiding them in too much detail. I think the design labs were a fantastic way to be able to engage with more people, because they were positioned in trusts in busy areas, perhaps in the canteens around lunchtime. So we were able to approach some people, and people were able to kind of come and join us, and were able to participate in that way. So again, Paula, I think it's mainly about understanding the hospital environment and patient, staff and visitor challenges, and working a way around them as best as possible.
Now I'm gonna give the floor to Hayley Lapalm. She's program designer, facilitator of the Nourish program in Canada. Nourish is a national leadership program for Canadian healthcare innovators working to build a culture and practice of food for health. As facilitator, Hayley supports the national cohort of practitioners to conduct experiments and collaborative projects at both organizational and systems levels to advance understanding about the impact of food in healthcare on patients, staff, and communities. Together with Hayley, we have also 3 co-leaders of the 5 projects that comprise the Nourish program. Dan Musso, Annie Marquez, and Stephanie Cook. I'm really excited to have all of them here with us, and as I think this is the first time actually they are presenting the project in Europe. So please tell us more about the program. We are really looking forward to it.
Thank you, Paula. as Paula said, it is our first time presenting the work that we've been doing in Europe, and so you'll hear from myself today as the program designer and facilitator, and then from 3 of our cohort members. But first, I just want to say thank you again to Healthcare Without Harm for having us, and also Susanna for your presentation. We were remarking in the comments that we're facing many of the same issues, and so it's wonderful to have the occasion to speak as an international community working to advance sustainability within healthcare. So Nourish is a national leadership program, community of practice, lab. We borrow from a lot of different elements and have come together as a national group of 25 cohort members representing 25 different health organizations of various sizes from across the country. So you'll see small photos of each of the innovators, and each of them is supported by their health organization, whether it's a health authority, a municipality, buying for long-term care, an urban acute care hospital, a rural indigenous health center. They all have the support of their organizations to be part of a 2-year fellowship program that is really exploring a big question around what's the impact that healthcare has on the food system, and what value can food bring to the well-being of patients and staff. So we have 25 inspired leaders who have direct power on food decisions in 25 engaged health organizations who are wayfinding to a future where the impact of food on health is understood and valued. And that's really the central point of departure for our program, this idea that food is not highly enough valued within health organizations. And so we see symptoms of this problem popping up in the form of a $26 billion price tag, which is the cost of 5 chronic diseases that are most related to diet and nutrition. Those are the direct and indirect costs to the health system. Another symptom is the $2 billion annual price tag related to malnourished patients who stay in care 2 to 3 days longer, or just the fact that when our team did the calculation, we found that food accounts for 0.01% of the average total cost of caring for a patient. And of course, patient satisfaction scores are never fully what we would like them to be when it comes to food in hospitals. So our idea is to come together as a group and to look at exploring the idea of how can food in healthcare elevate the patient experience, the organizational culture, and community well-being. So today you're going to have the opportunity to hear deep dive work from 3 of our cohort members who are leading 3 of the national collaborative projects, but I'll set it up a bit more before we get to them. As you can see from this slide, we're really using the power of question, curiosity kind of a lab approach to conducting experiments and exploring how we can elevate the experience across these levels and have a positive impact for the health organization by valuing food. So the future that we're after is one where we understand the impact across these levels. And we've published an infographic recently that you can find on our website that actually explores the pains and gains or symptoms and opportunities of valuing food more centrally within healthcare. So you can find that one on our website. But really, our theory of change, the way we work, is this idea of starting with individuals embedded in health organizations and supporting them on their own learning journeys and supporting them to learn from one another while doing experiments at their own organizations and nationally on an array of projects that will basically help give us insight into what practices are most impactful in terms of creating change at the organization level and then also at the system level. So there are projects undertaken by each cohort member. They're as described on the screen here. So we have a number of cohort members who are doing projects around procurement, some around gardens, many around reworking menus, understanding the patient experience, and so on. In addition to the individual work that's happening at each organization, there are retreats and other moments online for virtual convening for the cohort members to learn from one another. So here you see one of my favorite photos, which is a picture of Dan Munshaw from the city of Thunder Bay, and Kathy Loon, who is an Anishinaabe woman from Menayawin, a smaller health organization that is in Northern Ontario. And these two, or this image for me really symbolizes the kind of learning and unlearning that can happen when two people come together and they're able to leverage the collective wisdom, resources, relationships that each have to work towards a better future. And so you won't get all of Dan and Kathy's story today, but I did want to share, just as a way of visualizing, in a sense, the kind of power that peer-to-peer learning has had in our cohort. But I'll move on for now, and I'll just share kind of high level what impacts our approach has had. So in terms of individual learning, this national cohort model has led to a high degree of individual learning and growth. So we have a lot of evidence around this just in terms of people's motivation, new beliefs about what is possible at their organization, new relationships that they have been able to form, and even shifts in worldviews. In terms of organizational learning, at this point, about 3/4 of the way through the program, we're seeing varied degrees of adoption of new ideas being integrated at the organizational level. So one of the things that you'll notice when our cohort members present is that often a lot of innovation is still happening at the edge of organizations, where, for example, strides are made as exceptions off of food service contracts or outside of contracted purchasing rather than within the contracts. And so that gets to the next piece, the systems learning. Our work really is about how can we change the rules of the game, the core beliefs that guide our work, and just the number of people who are on site or organizations valuing food and care so that we can get to systems impact, where the new norm is valuing food and care. So at this point, it's too early to tell whether our cohort program is having an impact at the systems level, and that's something that our team is watching closely as we decide how we move forward in the future. So the process I really want to tell you about is one where our cohort arrived at a suite of national projects that had the aim of leaving an impact on the system. So we went through a process of the cohort pitching 14 ideas last summer, refining them, building teams, and then ultimately making a decision as a group and landing on a suite of 5 projects that they would work together on and divide $100,000 across. This was a fun way for folks to become invested in each other's ideas, see the system from a different perspective, and then ultimately think collaboratively about how working together would enable them to get further than, say, if they were to work on a project alone. So the group landed on this suite of 5 collaborative projects. So the ones that you'll hear from today are, I'm just having trouble seeing on my slide. So the ones that you'll hear from today are ones in the, on the top right around sustainable menus, and then as well one around building national RFP models, so values-based procurement, and then also one around better understanding the patient experience by creating a national tool to measure and talk about how food is impacting patients' food experience. There are also 2 other projects, and these ones are related to a unique policy window in Ontario, a province of Canada, and then one around building capacity for traditional and cultural food programs within health organizations. So I'm going to pass it over next to Annie Marquez to speak about the Sustainable Menus Project. She is one of the 2 national co-leads for this program. And then subsequently, you'll also hear from Dan and Stephanie. And I just want to make a note that these projects are still kind of like halfway through their development cycle. So we're still learning, we're still conducting tests, and we want to invite you to come share in the final learning of the program in May 2019 in Toronto, where we'll host a big final capstone event for the cohort. So Annie, over to you.
Yes, hi. So my name is Annie Marquez. I'm a food service manager in Montreal, Quebec. and I'm a leader of the collaborative project, A Guide to Sustainable Menu. So the idea of this guide comes from a wish that menu managers move away from the vision of food as an expenditure or nutrient only to a vision that food is medicine that has a big impact on the planet and on our community. Since our focus will always be patient satisfaction, we know that they are not ready to change to a fully plant-based diet, which would have the greatest impact on sustainability. But a lot of small changes can already be done. We needed a tool that facilitates sustainable choices for menu manager without adding too much to the way they work. The guide would make it fast and easy to choose differently. Right now, we think it's too hard or impossible to make sustainable choices, or they don't even think about it. They don't have the time. In our guide, we consider the 3 dimensions of sustainability for each type of food in the guide. Yes. So we did a survey with our Nourish cohort on all the 41 criteria we found to consider while doing food sustainable procurement. And we realized these facts. First, that the majority of the criteria could be implemented if they took the time to do them and if they had the right information to know exactly what to do. The second thing is that we must inform the suppliers so they can adopt new criteria before we can implement them. And finally, that we would need some help from our government to change some of the practices before implementing. So this is why the creation of this guide is almost a condition to increase sustainable choices in the menu of healthcare providers, because it would provide the right information to work with. So some food service managers in Canada are already changing things and are inspiration to others. So these are some examples. There's a pediatric hospital in Montreal that is serving fresh, local, organic vegetable in season. There's an elderly home in Ontario that is producing honey and doing gardening with their residents, and the food is served in the food service. In my sites in Montreal, we are reducing red meat. We are trying to choose more sustainable fish, and we are finding new ways to increase legumes while keeping patient satisfaction, like this Alfredo sauce made of white beans. In Quebec, they will soon be adding sustainable criteria to their RFPs. For example, they will ask for meat with no antibiotics, no GMO in fruit, vegetable, or in grain, or they will ask for sustainable practices for aquaculture. So our guide will refer to these real successful examples. So the guide is meant to be the ultimate reference for menu manager to plan an offer that will best answer their patients' needs while reducing waste. It is created to facilitate the multiplication of those sustainable changes. It's designed to integrate perfectly with their current work. We are presenting the information in tables from the change with the greatest impact to the smallest but useful change for all the food contained in the user trays. So there's one section for each type of product. There's the soup section, protein section, starch, vegetable, dessert, condiment, beverage, supplements, and snacks. So you choose where you want to start and create one little change at a time. The tips given by section are real, concrete, and feasible with a step-by-step approach. Here are some examples that you can see. So how to reduce meat, how to increase variety, to avoid undesirable additives, and to learn more about indigenous food, for example. So to make sure this guide is used, it has to become the first tool menu manager needs to work with, because it gives the answer on how to choose food for socially, economically, and environmentally sustainable. It's an interactive website. An interactive website will be created with a search engine, or you could start with a questionnaire to begin your own adventure with. There will be printable tools and certificates that will help every menu manager to do its part. If you want to help us make this happen in Canada, you can be part of our review committee or be a panel member for testing the tool. So you can contact me through this email. So thank you. And now Dan has some other great information to tell us.
Thank you, Annie. Thank you very much for the opportunity to be here this afternoon and to share the project that we're working on. Our Nourish project, as Haley had mentioned, is the creation of a national RFP project for the procurement of foods. We've heard people speak about serving healthy and local foods, and I appreciate the comments Susanna made at the very beginning. And interesting to see the parallels with the challenges on foods and healthcare, recognition of sustainability, budget issues, inflexible contracts, locally sourced foods. These really mimic the same challenges that we're dealing with here in Canada. So what we're trying to do is to develop a procurement tool that will enable us to buy the right ingredients and the right foods to support our residents and our patients. But in addition, because we're spending public taxpayer dollars, is to utilize the leverage to advance sustainability, social benefit, regional economic, and other considerations. So we have great power if we use the tool and if we use public spend properly. Some examples of successes that we've been able to achieve, to share what we've been able to do here at Thunder Bay. In the top photo, we engage forward food buy contracts with local farmers who are plowing up and planting fields of food specifically for us, and we enter into contract in advance of growing. We're using local greenhouse vegetables and fruits and greens directly in our meals. And a newer venture is we're reaching out and doing business with Indigenous harvesters and incorporating Indigenous foods into our food supply chain and our meals. So the RFP model that we're looking, actually in the process of building, can have multiple forms. And as Haley mentioned, this is a work in process where we're at right now. Certainly those familiar with procurement, we have the ability for direct negotiations, and we can do that with things like food forward contracting. Request for proposals for smaller dollar values, 100,000 and less, we'll develop it in the process of developing a tool for that. On some of our larger contracts where the value is greater than 100,000, there'll be a tool to go open to the market for competitive bidding. And also, as mentioned, in many areas within the public healthcare system, hospitals outsource their food service operations, and we're looking to build an RFP model to ensure organizations engage the right companies to deliver food services for them. So the models that we're looking to build or in the process of building begin with an education, as you have to help share knowledge on how to use the tool. The tool will be fully customizable templates so that your organization can modify it to adapt and adopt your organization's goals and objectives. It'll include things like mission statements, connecting a healthy patient-resident outcomes to healthy foods to create that link. Suggest specific terms and conditions geared to foods, recommend award criteria that move beyond price and move beyond budget, and they include criteria of sustainability, social benefit, regional economic development, and have some nice tools that you can slide the bar up and down depending on your selection of criteria, weighting values. And we'll have, we're looking at having reporting tools, contract compliance, annual reporting. It's not good enough just to do. You have to measure and report as well. Some of the challenges that we face, and listening to those in UK as well, we have compliance with legal and international trade agreements that we have to work with. Often in procurement, we're dealing with conflicting trade-offs. We're all working with tight budgets, but how do you factor in a tight budget with quality and sustainability? How do we include and articulate properly regional, culturally appropriate foods? The beta testing will develop the model, but we need organizations to test it, and maintaining and refining the tool as we learn and maintain relevance of the tool. And that's the work that's currently underway on the RFP model to ensure healthcare organizations can buy the right foods for their residents and patients. Thank you. Stephanie, turn it over to you now.
Great, thank you, Dan. My name is Stephanie Cook. I'm the Director of Nutrition Services with the Saskatchewan Health Authority. And I want to echo both Dan, Haley, and Annie to thank you all for this opportunity to share with you our Nourish projects. And the one that I've been leading is a project related to measuring the patient food experience. The impetus for this project came from a collective frustration amongst our Nourish team with the commonly held belief that hospital food is terrible and is of little value to the overall patient experience. Our goal was to begin to change this negative story of hospital food and replace it with a more positive and accurate story of the critical importance food plays in the care of patients. The stage had already been set, with recent evidence showing high rates of food waste in hospitals, coupled with alarmingly high rates of malnutrition amongst hospitalized patients. Yet at the same time, evidence suggesting food and care is a key predictor of overall satisfaction with the hospital experience. I know in the hospital where I work, and from talking with my colleagues, that food services staff care very much about the food they put on the plate, which simply does not line up with the negative stereotype of hospital food and the high rates of food waste. We know that food in care matters, but do we know what matters to our patients? So to help understand the patient experience with hospital food, we embarked on a journey to find a tool that could measure the many dimensions of the hospital food experience, including an understanding of what patients expect and value, as well as a measure of their satisfaction with the meals they are served. Our vision was that this tool would be adopted as the gold standard quality indicator and could be used nationally to better establish best practice standards to achieving high patient satisfaction scores and begin to redefine the importance of food in care. Setting out on this quest, we soon learned that Nourish was not the only organization interested in measuring the patient experience with hospital food. In fact, a group of colleagues from the Canadian Malnutrition Task Force had already begun devising a tool. This led to the development of a partnership that would expand the scope and breadth of both of our projects. And the Nourish group was one of the first to get out of the gates, and we actually trialed the tool with 150 patients across the 2 acute care hospitals where I work. We want to share with you just a little bit about what we found in that pilot study. The tool consists of 3 main parts. The first part of the study is a series of questions aimed at measuring the patient's expectation of hospital food. The second part of the survey questions the patient's satisfaction with the meal they've just been served while in hospital. And the third part of the survey allows for the patient to provide open-ended comments on any additional thoughts or suggestions that they might have for the food services department. The results from the 150 patients that we tested revealed that the majority of the aspects of hospital food measured, such as temperature, variety, and smell, were rated as important or highly important. But it was food that was identified as fresh, tasty, and healthy that received the very highest ratings. Our study also determined that satisfaction with the food was directly correlated with how much that patient ate. Lastly, the results enabled us to pinpoint the meals that were most and least popular and make changes aimed at better meeting their expectations, like adding more fresh and healthy food items prepared from scratch in our hospital kitchens. So what's next for our project is we want to take our show on the road, and this means recruiting hospitals from across Canada. Our goal is to have data from each province and territory encompassing more than 20 hospitals and 1,000 patients by this spring. We want to continue to grow that database. Our hope is that with the data that we're collecting, we'll have a much better understanding of what patients value in terms of their food experience, as well as what changes can we make to hospital food services that will have the greatest impact on that patient's satisfaction with their food. So ultimately, our main goal is to really reaffirm and revalue the importance of food as part of the care of a patient. I've left my email address there, and if you're interested in more information about the study or how to get involved, please contact me. So on behalf of our Nourish team today, Haley, Annie, Dan, and myself, I'd like to thank you very much for your time and your interest in the work that we've been doing. We look forward to future collaborations and hope that the next time we meet, it will be in person, and it might just be in one of your many beautiful European cities. So thank you very much.
When I first read about your project, I kind of fall in love with that actually, and I really hope like we can help you here in Europe, and also some of our members actually became more engaged on this, so to try to participate maybe in any of your pilots or testing, so you can get also more experience from that beyond Canada. I'm just gonna ask you a couple of questions that we got. Overall, how would you assess the impact and success of Nourish? Because you said like there is some of the projects that are still halfway and others probably are more advanced than others. How are you monitoring all of this?
Thank you for the question, Paula. I think because we're working around a 2-year fellowship program and we want to have systems change, which we know takes 10 years, we know that the blueprint for a new health organization, from blueprint to building and operating, is like 10 years. We're really looking to see what signals there are now that we're on the right path. So if we can get feedback from the system, for example, in terms of shifts in resource flows, new relationships, that would basically provide evidence that there is a shift happening. So there is an evaluation framework that we're basically using that looks at kind of 5 different areas that we can track to notice if there are signals of things shifting. And so again, those are resource flows, relationships, power and authority flows, routines, and beliefs and culture. So we're actively monitoring impacts that we see in each of those areas, and then ultimately are trying to understand what we can observe now tells us about where we think things might have and what traction things might have in the future. So a good one would be if you see a CEO who creates a new policy or adopts a policy, for example, around doing more values-based procurement, or that would be one kind of example.
Great, thank you. Yeah, you mentioned the input role that national policymakers can play. How are you going to engage them then?
Right now, there's very little policy that exists at the provincial, territorial, or federal level in Canada that governs how food and healthcare is delivered. It's instead more governed by the realm of practice, budget allocations, broad-line supply chain structures. So we are looking to, while working at those levels, we also are looking to work with leaders in each of the provinces and territories and with different nations around practices and policies that would work for them. often we do this through our cohort members. So we have a cohort member, for example, in British Columbia who has a strong relationship with ministers of agriculture and health in her province, and so we look to strengthen those relationships, share information, partner. Basically, we're working on a model of incremental change and engagement with the willing. So yeah, really working with the willing and creating spaces for policymakers within the country to share practices and ideas.
Thank you, Heidi, for explaining this further. I would like to ask you as well, like if you could launch Nourish again, what would you do differently?
I would call Susanna and I would ask her to tell me more about the work that they're doing around the certification for the whole hospital award. The truth is that I think the program has really been designed with a spirit of experimentation. So it is only a 2-year-long program, and we're actually currently in the process of asking that very question and looking at what we would do in the next iteration of the program. I would say that the thing that we got right was doing things in partnership with other organizations, and at the very end of our slide deck, we've got a list of our amazing partners like the Canadian Coalition for Green Healthcare and others. But I think the thing that is really tricky for us is that I think we do an okay job, and Dan, Stephanie, and Annie can agree or disagree, of working at the individual level. And I think the thing that we are really struggling with is how do we get a total conversion of organizations who are adopting the practices, vision, and values of the innovators who really are on the leading or bleeding edge of innovative thinking about how to value food and care. So I think that's our area for learning and improvement. It's how do we kind of get the individual learning cascading into organizational learning more consistently, and I think actually we couldn't expect to know that maybe in the first round, but we're looking certainly to see how we can learn from it for the next one.
I'm sure like this is just the beginning of our collaboration between you and Susanna from UK and even us. So we are actually happy to exchange more of this and even attend your capstone project next year. I might ask as well a question for Stephanie about about how you measure satisfaction actually, because there is some of the parameters you mentioned that here in Europe are seen quite subjective. I would like to know how do you really evaluate those?
Thank you for that question, Paula. We agree, measuring satisfaction is tricky, and we felt that one of the dimensions that seemed to be not captured when you measure satisfaction with food is also that measurement of what was your expectation of that meal or of the food in hospital. So much of our survey does focus on getting a sense of what patients' expectations are with hospital food. But to measure patient satisfaction, we focused in very specifically to the meal that the patient just ate. So it would be it was administered immediately following that, and the attributes of that meal were ranked on a 5-point Likert scale. And we measured parameters of that food, I think quite traditionally, like many other satisfaction surveys, so asking about temperature of the food, variety, what was on the plate, the smell, the taste, how they would rate the healthfulness, portion sizes, all of those basic components. But it really came, I think the value came when we linked that data with the expectations data as well as our intake data. So we also measured exactly what that patient ate at their meal, and then we're able to correlate that with their satisfaction scores. And it might seem so intuitive that, you know, the more a patient likes the meal, the more apt they are to eat it, but we struggle to find any evidence supporting that. So to actually have that evidence really, you know, speaks to the fact that if we're providing good food, good and wholesome food, patients are more likely to eat it, and patients more likely to eat food are going to get well. So I think that sort of combination of findings was important and impactful for us.
Definitely, patient satisfaction has an impact on patients' intake and also the way they recover life, so they can recover better. So yeah, thank you very much. I really like this webinar actually as a whole, but unfortunately we are running out of time. So if you have any further questions, please feel free to contact our speakers today. Here you have their email addresses, and if you have any further questions, we will be happy as well to forward these messages to them. If you write to europe@hcwh.org. I just want to wish you have a nice day. Yeah, keep in touch. Thank you very much.